Oh, shoot. Okay. I guess I am on. um, Aloha again. Um, I again am Dr. Albert Lin, the traveling doctor. Once again, just for a quick update, I'm Stanford educated. Uh, in college, I went to NYU for medical school where I got my MD. I did my internal medicine training at Cedars-Sinai, and I have been a practicing internal medicine hospitalist for the last 14 years. So it's been a crazy 24 hours, like I think a lot of you have known. Thank you for all the support. Um, I've had a lot of questions, and I've had a lot of support and love thrown out to me for the community and friends. It means a lot to me. As some of you know, I had some symptoms, which I'll go into, and I got tested recently for both the flu and COVID-19, which I know actually there are 1,000 questions on. I'm going to focus most of my time today on the test. What is it? How do you get it? Why do some people get it and others don't get it? Other alternatives, the timeline, and also just general kind of pros and cons about it and what we do with that information. Also, again, live stream me and add any questions on the live feed. I can't tell you, I've gotten probably 50 to 100 questions since yesterday, and a lot of them repeat, and they all come after this podcast. So I think a lot of you have the same kind of questions or are watching it later, and probably you that question, other people have the same question too. So I'll do my best to answer it, in my capacity. Just to clarify again, I'm a hospitalist doctor. I'm internal medicine trained, so I'm not a PCP. I work only in the hospital. What that means is I get the sick patients from the emergency room and I take care of them on the floor, whether it's the wards or the ICU. I help run the ICU. If you've ever watched Scrubs, which I think a lot of Americans of a certain generation have watched that show, especially recently, I'm like JD or Dr. Cox. I basically round on patients while they're in the hospital, but I don't really work in a clinic outside. So I take care of sick patients inside the hospital. So anyway, with that, I think I want to go into a little bit about, well, first, what the test actually feels like and why I got it. So first of all, I think I want to sort of explain a little bit about why I got the test. And I'll tell you it in a timeline. I think a lot of people can probably understand why I ended up getting the test, both as a healthcare professional and how, there's this idea that certain people can skip the line, or, Charles Barkley or, Idris Alba, all these people are really offended that they cannot get this test. And why did I get the test? Why did someone else get the test? So here's the timeline. As a lot of you know, I went to New Zealand in January. I left around January 16th. It'll probably help if you look at a calendar. And I was there until January 26th, so about 10 days. That whole time I was running around solo. I wasn't with anybody. I was taking buses to sort of popular areas. I went to Hobbiton, where Lord of the Rings was filmed, as some of you saw on my Instagram. I went to a town where I think is a big problem where I got pneumonia, called Rotorua. And it's well known for having these thermal spas, public thermal spas, steaming 90-degree thermal spas. Again, they're public. And one day around, I think it was January 20th or so, I decided, or I think it's January 22nd, I think it was a Wednesday or so. I've washed my hands, so I'm scratching my face. I went into a hot tub and I was relaxing and I felt really good. And there are a lot of foreigners around, a lot of tourists. I won't mention what type of tourist or what ethnicity, but let's just say they're from a country that has a lot of tourists and has a big COVID-19 problem. So I was doing, most of that, and I felt fine for the rest of my trip. I went down rest of North Island. I went to Wellington, where I was fine. I walked around, did my normal thing, didn't have any problems. And then I flew back up on January 26th to Auckland, and then I took a 10-hour flight home to Hawaii. Now, at that point, on that flight, I had problems, kind of like what it sounds like Daniel Day Kim had. I had aches. I had some chills, but no real fever. I didn't really have a cough, but that's what happened. And I felt really bad by the time I got out. Luckily, I had a whole road to myself. I wasn't sitting next to anybody. And I went home and I immediately fell asleep, just napped, took some Tylenol, and I had some soup. And luckily, the next day I had a doctor's appointment with my primary care doctor, just my annual checkup, just randomly. And I went to see him on January 27th, the next day. And he didn't seem that concerned. At that point, no one cared about COVID-19 then. I got some labs done. They were totally fine, except for a little lymphopenia. That means my lymphocytes are a little low. But no one thought anything at the time. The rest of my stuff was fine. My liver tests were fine. My white count was fine. Everything was fine. I did not get a flu test, which I really think I should have done at that time, but I wasn't a doctor. So I didn't get the flu test. I didn't get Tamiflu, but he gave me a chest x-ray. The chest x-ray showed I had a left side lower lobe pneumonia. Now, you may know COVID-19, a lot of times people get a bilateral pneumonia. I did not have that. I had a left lower lobe pneumonia. I feel a little cruddy, so he gave me a Z-Pack. I took the Z-Pack for 5 days, and it didn't really totally work. So I went back, and he gave me a double gun of Augmentin and doxycycline, and he gave me a CAT scan. The CAT scan showed, again, I had a left lower lobe pneumonia, but I was resolving slowly over time after that period with the antibiotics, and I didn't get worse. I mean, I had a little cough, and I was at work, and I covered myself, and I washed my hands and everything. Then I was fine for the rest of the end of February. I went to a good friend's wedding. I went, relaxed a little bit for a week in the beginning of March, and then I think I worked for about 6 days from March 8th to March 13th. That was just a couple of, actually about a week ago. So on Friday, March 13th, I was finishing up and I started to get a little cough again. And I'm like, this feels weird. I saw an interview with a patient on CNN. I had very similar symptoms. I had phlegm in my throat. I had a little bit of a cough, like a dry cough, but it wasn't bad. It definitely wasn't as bad as my my cough and pneumonia from February. And I have to say, in February, I had part of the cough, even after the Z-Pack, I had a dry hacking cough, really, really dry. I mean, I'm talking severe. I've had flu before. I've been sick before. I've never had this. It was so bad. I was having dry hacking cough, and I was coughing so hard, I almost felt like I was having a hernia. If you know where your inguinal region is, which is near your, scrotal area, I was coughing so hard, I literally felt my intestine might pop out. And it was very, very annoying. I didn't think I was going to be so short of breath or anything, so it was fine, but it was bad. It was very, very bad. Again, this time it wasn't that bad. So I wrote my PCP and I said, hey, listen, I had a bad pneumonia in January, February. You know it. I had 3 courses of antibiotics. I had a chest x-ray and a CT scan, and I felt fine, and I thought things were okay, but now I'm developing a little cough again, and I got to go back to work next week. What do you think? Do you think I should get tested? I didn't demand it. I just said, what do you think? He's like, you know what? You have enough risk factors. You had a pneumonia. You're a healthcare professional. You've traveled, but I didn't travel to a high risk zone. And that, was, the one thing that I didn't have. I didn't have any high risk exposure. I wasn't with a patient that had COVID-19. Oh, I'm sorry. I should mention, one of the patients I took care of last week, I thought might have COVID-19. So I tested her for it, and I didn't get the results back. So I think that, knowing all that, and we didn't know what was going on, that's how I got the test. Now, let me explain what the test is like. So the test, you have to get it approved by a doctor, as I mentioned before, because we don't have that many tests available. Again, and I'll explain why that's an important thing. So you get it approved by your doctor. You can't just show up in the emergency room. You drive in to an area, at least in Hawaii, you put your license and your insurance card up against the window. They don't want you rolling it down. And then you go into sort of this little like driveway area. They've got 4 of them set up, and then they come over, a guy fully, gowned up with the mask, everything, and they take and this is, I'm gonna be honest, it is not tiny. It's not like they say a swab and you think it's like a Q-tip on your nose. I'm not joking. It's like this big. It's skinnier. It's like a pen, okay? But it's like a pen size. It's literally about maybe four and a half inches long at least, and it's on a small metal bendable thing with a tiny little cotton swab, and they jam that this high. They jam it up here. They jam it up and they like stick it around, and then they do like that, and it's painful. It's not that fun. You really want to sneeze on them, which it completely is a bad idea because, of course, you might give it to them. So you have to try not to sneeze, and then they go on the other one. And then they jam it up here, and then they do this. So when you're asking for this test, realize what you're getting, a jammed thing. It is 4 inches long, and it is skinny, but it's not this thick. Mary's saying it's not that big. It's not this thick. It is that long. It's about 3 to 4 inches long. And it's not pleasant is what I'm saying, So be careful what you wish for. That's what it is. And the reason they test it on you is because they have to test you for the flu first. Why did they test you for the flu? Because all things being equal, you have possibly the flu. And if you don't have the flu, then they send it off to get tested for COVID-19. And it has to be approved, again, by your doctor. So now I got that done on March, I think it was St. Patrick's Day, basically, I got it done, which is what, the Tuesday, was it? The 17th. It takes, for whatever reason, it takes something like 5 to 7 days. My primary doctor said something like 3 to 5 days, and then he said, oh, it might be more like 3 to 7 days. And then I know personally for ordering for my patients, it took a week, and it goes to Texas, and it's not very fast. Okay, so I can go into the details of why it takes that long, but it basically has to do with Hawaii doesn't have enough tests. It's not set up the right way with the right reagents and the right labs, and that's what happens, So it just takes time to go to the mainland to be assured that it's right, and then they report the test back to you. So as you can tell, I haven't been that sick. I do have that cough still, a little irritation. I took the meds that I told you about from before. I took some zinc lozenges. I did not take acetaminophen because I didn't have a fever, headache. And I took a little bit of some Hall's menthol stuff, and I felt pretty good. Had a little bit of a sore throat yesterday, actually after the last podcast, but that all went away. I had a little bit of mild shortness of breath today, but it's not bad. I mean, again, knowing that history, I don't know. I personally and professionally, I think I have about a 50% chance of having this thing or not. And I need to know because I'm going back to work on Wednesday. So that goes into, like, again, I talked about this before, but the rich person thing. Why do certain people get this test that are rich? People like, oh, well, Charles Barkley, he got it. And Idris Elba, he got it. They're just rich. They paid for it. And that may be possible. If you're shocked that rich people get things before you, you obviously haven't seen the courtside at the Lakers game. And rich people and famous people get things for free all the time. Please do not be shocked about that. It sucks, but that's life, and they have their own special doctors, and that kind of sucks. But I also have to say, we don't know their history. For example, I was reading Idris Elba, he's Black James Bond, but he has asthma. Asthma is a bad thing to have. People with asthma, lung disease, can get really sick really quick, and maybe he had exposure. I don't know his deal. Same thing with Charles Barkley. I'm sure Charles Barkley, he's a big basketball player, but he's a big basketball player. If you see him on TV, I don't know. He has diabetes, chronic kidney disease. I don't know his deal. So I'm not going to prejudge him. You have to ask yourself, if you're getting these tests, which I do think are important, and I wish in an ideal world we had 1 million, 1 billion. I wish we had one for every single person you get right now. But ask yourself, if you had that test, okay, say you're your typical person, me, you're not really sick, maybe you have some weird symptoms, fever, muscle aches, you were near someone sick and now you're starting to feel sick or whatever. If you have that test and you're flu negative, well, then what happens? If you get that test and let's say you're COVID positive, then what will you do? You will quarantine yourself for 14 days, right? At least 14 days until you get 2 more negative tests, and then you can go back to your life or whatever. Right? But then ask yourself, what if it's negative? Are you just getting this test because you're happy that it's negative? Well, then what happens if it's negative? Are you suddenly going to be like, I'm fine, I can run around now? No, you shouldn't be doing that anyway. So I think what's going on is people are just frightened. I have not seen this level of anxiety. I have not seen this level of panic since 9/11. Again, a lot of you know I was in NYU, which I'll get to in my US update, during 9/11. And I talked with my med school roommate, who's an orthopedic surgeon in New York today, for about half an hour. And we both agreed we've never seen this level of panic, even after 9/11. After 9/11, there's camaraderie. Everyone's like, well, kumbaya, we'll get through this. And, people were helping each other out. The day after 9/11, people were drinking and eating in bars and restaurants. And we can't do that right now. So my point is, ask yourself, why is everyone so worried about the test and wanting it? Yes, we need the information. I know, I understand, but why do you want this test? And I posit to you, it's just a little bit of this Costco TP hoarding effect. I mean, you don't really need it because will it change your behavior? No, you should still be self-quarantining for 2 weeks regardless to help society. So it won't change. You'll still be washing your hands. I mean, if you're very short of breath, if you're symptomatic, if you're whatever, of course you should go. You should go or talk to your doctor at least and get set up to get the drive-through thing and make sure that you get the test. And then we can see, and if you're short of breath, you might need some oxygen, you might need, other things, they might need to take your vitals, and then that's important to get it. But what I'm saying is that why do people hoard toilet paper? We all know your butt is not that bad and you don't have that much diarrhea that you need that much toilet paper. Why are people hoarding sanitizer? Why are people hoarding tons and tons of cans of food? And why are they now, again, hoarding the hydroxychloroquine, which I'll get to later? Because people want control in an uncontrollable world right now. They have anxiety. They don't have any other way of controlling, things. They've got cabin fever. We all want to get out there. We want some semblance of power and control over our world again. And getting that test, I think a lot of us feel that if we have that test and that knowledge, then we'll be able to live our lives. But you know what? We won't be able to go back to our lives anyway because we'll still have to help people. Stefan asked me, how much toilet paper do we recommend we hoard from Costco? You know what? There's actually a funny little thing online. It's a toilet paper gauge, and it lets you plug in how many times you go to the bathroom. And I have like 18 rolls of toilet paper that I just had, not from Costco. And I go to the bathroom like 3 times, and it says I will last like something crazy, like 90 days or 80 days. So like more than 2 months. So I would say, yeah, plan for maybe 2 months of toilet paper at this point. If you have 2 months of toilet paper between you and your family members and everyone, then that's an important thing to have, and have a certain amount of food. But I do go out, with my mask, very careful, once every few days to just carefully get stuff from the grocery or take out and come back. And I do that very, very carefully. So, I'm telling you, the reason why we all want the tests is we want control. We want control right now, and we don't think, the government's doing a good idea. We see all these deaths. We see all the bad news coming out of Italy, whatever, and we feel really bad. We want some semblance of control. So let me go into a little bit more about tests. We were behind the ball on tests. And I don't mean we as in the doctors, I mean we as a nation. I'm not going to place the blame on this, on the CDC or Trump or whatever. It doesn't matter right now who did, we have to deal with it. I mean, I heard a really good quote on the TV the other day where people were going back and forth about, like, again, would you rather make a point and be right, or would you rather make a difference in the world? Would you rather be the person be like, I'm right and that person is wrong and that's where we're in this problem? Or would you rather make a difference? Like, I would rather make a difference. I don't know about you guys. So how do we change this now? Well, I've been talking with the other doctors. Again, I'm on a Facebook group with doctors. We have talked to the lieutenant governor right locally of Hawaii, who luckily he's emergency room doctor, Josh Green. We're trying to get more tests going. We're trying to get more of the emergency medicines and masks we need. We're slowly getting more information as you watch a White House press briefing on this stuff. And I mentioned to some people read my thread, because the US government is behind on the testing thing, and they know the testing, again, it's not very reliable in terms of being able to be a quick turnaround. You order it and you got to wait a week, right? that kind of sucks for everybody. What do you do for that week? They kind of have to hang out in that hospital bed until you clear them, even if they're slowly getting better, all the time taking up that hospital bed from the numbers and numbers of people that are pouring into your emergency room for the same thing. So what do we do? Well, the government has allowed the FDA to approve certain what we call community-based private lab people to do it. And one of the places is this company called Everlywell. You can Google Time Magazine, Everlywell, and COVID-19. There's a test. There is an at-home test that will be available by March 23rd, from what I hear. March 23rd. March 23rd is in 5 days, guys. Or wait, no, 3 days. It's in 3 days. Technically, it should be available. And it costs $140 or something like that for you to get it at home. You get it at home, and it's a home test. It's sort of like the 23andMe of lab tests. And this company has started to make its name for it. Again, this is not some BS test from what I understand. It's FDA approved. And if you want to know so badly, you don't want to run around and go to sick doctors, go while sick to doctors' offices and you want to social distance, you can order this online if you want it. Now, again, I have mixed feelings about this, because if we get this test and we have it, and I am trying to procure a lot of these for the state of Hawaii through back channels and some friends who are really awesome, where we may be able to get a lot. I'm not at liberty to say how many, but a lot for the state of Hawaii, and they're working on it with California for testing, and that will help a lot. But again, remember, be careful what you ask for. Like, you'll get this test at home, and it's, as I understand, it's a self-swab test. I have to check on this, but you may have to, again, take the thing and get up there, right? And let's say my biggest concern is two things about this test if you do it on your own. Number one, I'm concerned that these tests are not going to be done right by most people, that they will not get enough stuff, that you will get a false negative. In other words, it will give you a negative test because you didn't do it right and didn't jam it up there enough. That's my biggest concern as a clinician. And then you'll say, oh, I'm negative, I feel good. I can, again, go and be unhealthy and go out and go to the bar, and you know what, I'll let myself celebrate a little bit and go do keg stands with my friends, or go on that Tinder date I really want to go on, or whatever. Like, and then you'll slip up. And that's what I'm worried about, these false negatives. Any test with a false negative is dangerous in my opinion for the public. So that's my number one caution about that. I'm glad that it sounds like the turnaround time is really quick, that it's a lot less time. Once you get it and you do it, it will be ready for you very maybe by a local lab very quickly. And again, I have to check on this. The number two thing I'm worried about, these community tests like Everlywell and maybe the other ones that are coming up, is simply this. Has anyone ever heard of Theranos? Theranos, I mean, I'll give you the quick and dirty. There's this fancy schmancy, she was like the female Elon Musk of biological lab testing, and she created this billion-dollar company premised off the idea that you can take these very quick, tiny, like pricks of a finger, and that was gonna replace all the blood draws that we did for cholesterol and electrolytes and our blood count and everything, and everyone bought it. She was really smart. She had backing. She supposedly had lab data. She had all this stuff, and she even partnered with like Walgreens. And then guess what? This was a house of cards. As they started to see and test it, the lab data was not consistent. Theranos is, a danger. It's like the fire festival. Theranos is like the fire festival of testing. And I'm worried that if we rush tests too fast into the environment, and where everyone's scrambling to get these tests, we may either get too many false negatives, get too many false positives, then that's a problem. It's a problem if you get too many false positives. Then everyone thinks they have it, and then it's a lot worse looking than it really is. Now, again, Florence, she writes, again, if you leave the house, you might be exposed and you'll need another test. Yeah, it's tough. Again, we're trying to flatten the curve. Again, I think we're in the middle of this bad peak, and I'm going to start talking soon about the US. As you've no doubt heard in the 24-hour news cycle, it has been crazy. New York's been locked down. California has been locked down. Chicago is being locked down, or the stay-in-place rules, or whatever they call it. I don't know if they're getting ready to fine people for being out. My understanding is that they can fine you if you're not out for a legit purpose, like getting groceries, going to the pharmacy to get medicine. Again, I mean, what is stopping people from going out and lying that they're doing that while they're, again, on the way to family dinner or on the way whatever? This is very tough. This is where you start to get into that, how can we do stuff like China? We can't, because we're not a communist, like, authoritative, like autocratic society where China says, you don't do this, and they say, okay, like, we're America, we do what we want. Everyone knows this, and that is a problem. There are two types of people that I've seen as I've gone out very carefully to go get takeout, do my things and come right back. And unfortunately, on the streets, yesterday I was passing a Korean barbecue restaurant, full of kids. And by kids, I mean probably under the age of 35 or 30, really, around a steaming, hot, shared Korean barbecue place, sharing food, doing whatever, doing the opposite of social distancing. I saw strip clubs open. Come on, Hawaii. Strip clubs? Is that social distancing? Someone explain to me how you can have a 6-foot social distance lap dance. I don't understand the concept of it. I actually asked a friend, and they're like, well, they have these dollar bill guns, and apparently you can do this. But do you really need to go out to a strip club for a 6-foot away social distance lap dance, which is maybe more like 6 inches away? Like, come on. So my point is, you're one of two people. You either don't give a shit about people, and you think yet your personal benefit is more important, and your life is more important than society's and humanity's, and you cannot help out for 2 freaking weeks, or you think a little bit more about humanity, That's it. Julianne, she writes, they'll fine you here $1,000 if you don't follow the martial law in Cali. Okay, that's good. I'm $1,000 fine. I've heard, again, 35,000 people were fined in Italy. And okay, let me start going on to a little bit more of the, because we're starting to run a little long here. Let me start going to the US updates. So it's looking pretty bad right now. I got to tell you, I'm right now on day 7 of isolation, and I've been waiting about 4 days for my COVID-19 test. And we are right now about 8 days behind where Italy was. I'm getting some very disturbing news. This is legit news from my doctor friends in California and New York. New York is swamped. NYU is swamped, okay? NYU has 60 patients or so that are COVID-19 in just the hospital. They have 5 floors of just COVID-19 patients, and they have 3 more intensive care units of just COVID-19 patients. They're buying like 80 more ventilators in New York. People are being asked that retired to come back and be doctors, or that don't know how to do internal medicine. It's getting a little dicey. I'm worried that this is how Italy started up. So are we gonna avoid Italy? Not sure yet. I really still hope so. And I'm telling you, I'm worrying a lot more about the bigger cities here at NYU, or New York City, Chicago, Seattle, San Francisco. I've been saying this stuff for days. Honolulu, Hawaii, Iowa, West Virginia, Puerto Rico. Maybe we are behind the curve, meaning like we haven't been hit and we have more time. And just the way the US has learned from Italy's pain, Hawaii and these smaller states, we're going to learn from the pain of the bigger states. I'm going to tell you why I'm concerned. The government has sent out big hospital ships. You may have heard about these. One to New York, one to the West Coast. Now, why do you have these ships? You have these ships because you're worried you're going to run out of room. And these are military ships. I don't want to spread rumors. I don't want to spread whatever. But my sense is that these ships are meant to overflow, again, patients that are healthier and need to go somewhere, again, sanatoriums, quarantine after you get healthy in the hospital to free up room in the hospitals. I am worried about full martial law. And again, this is only a possibility. I'm worried about But I think would be necessary maybe full martial law in New York, in San Francisco, in Seattle, and Chicago, the bigger cities. I've seen unverified reports and videos of Humvees being transported. Now, this may be all fake news and other stuff. So again, take this with a grain of salt. But from me, a medical standpoint is you ratchet stuff up. You slowly take away things from the public that they aren't used to giving up. And then when you give up that last thing, it's not a bad thing. I think you may need it because people are obviously not staying home alone. And as Randy G says, if these mother effers stay inside, we'll be better. But they're not. They are not, because they're not in China. And that's so it is tough. It is very, very tough to say what is happening, what will happen. And I don't want to be alarmist. I don't want to be whatever, but we need to still stay inside. We need to still wash our hands. So let me get a little bit more practical. Someone else mentioned to me, well, Albert, what can I do? I can't stay at home all day. Again, I have roommates, I have whatever. The same thing, when I came back from my errand today, I took off all my clothes right away. I took them all off and I put them right, I won't demonstrate, but I put them right in my washing machine. I washed my hands. I even put the bag that I came in with into the washing machine, or into the shower. I went and showered right away. Again, if you're sharing stuff with roommates, it's very difficult. I mean, you can only social distance so much. Ideally, you stay away from each other. You don't share food. You share. You don't share anything if you can. You wash your clothes a little bit more. You wash your hands. You look out for each other. And try not to overwhelm yourself with 24/7 news cycle COVID-19 coverage, because you're going to go nuts. You've got to mentally take care of yourself too. Oh, by the way, I heard of something that there's some healthcare therapy service for healthcare professionals that's free. It's sort of their like intro thing for doctors, nurses. So if you're in the healthcare field out there, supposedly there's going to be this therapy thing for free. That's, again, virtual telemedicine or therapy that it would be useful. We all need somebody to talk to. This sort of podcast has become a little bit of my cathartic kind of thing. So going along, talking about rumors, by the way. Hey, that really touchy-feely good, oh my God, this is awesome story about dolphins in Venice, and the earth is healing itself, and Mother Earth and Gaia is doing better, and now there are dolphins and animals all over Venice. Guess what? That's a load of crock. It's bullshit. I'm sorry, look it up. Look up National Geographic. It is false. There are no dolphins in Venice. It just makes us feel good, and we want to grab onto that. There are swans in Bergamo, but those pictures of the dolphins were from somewhere south in Sardinia, out by the oceans and everything more. It wasn't Venice. So we all be careful of your sources. Even when I'm saying stuff, double check it, triple check it. Even the medicines that we were talking about with hydroxychloroquine, all those results, and I'll put the chart up, they were based on a sample size of less than 40 people. You don't make good research and good medical decisions on medical tests that were, and studies done with 40 people. With 40 people, right? So you can see some good trends and you can set up a good test for later, and maybe even it will be the good therapy, but you cannot say that this is a definitive test. Every journal, every medical journal worth their salt would laugh at you. It's just because of how desperate people are for information for anything right now. So there are no dolphins in Venice. I think that pollution thing being lighter in China is probably true on some level. I don't know how much. I'm not saying we shouldn't fight climate change. It's a great thing to do it. I'm just saying don't get sold fake news. You guys are smarter than this. The only person who wins are the terrorists, the trollers, and maybe Vladimir Putin in Russia again. We are wanting to grab onto any false rumor, every false little thing that sounds somewhat true from something, okay? So, that's really mostly what I would talk about. Okay, so again, New York, as I think Whitney mentioned, and she confirms it, and my doctor friends confirm it, New York City is getting hit really hard. The bigger cities are getting hit hard. What do I mean? They're full of high double digits now of patients. San Francisco General Hospital is getting full of high numbers of COVID-19 patients. They may not all be super sick on ventilators, but some definitely are, you know? So that's the update for the US so far. What's going on in Hawaii again? Again, we're trying to get more tests. We're up to 37 cases in Hawaii. Again, the famous guys, Daniel Day Kim, another state senator, there are more and more. They are saying now, by the way, the updating in Hawaii also is they think 2 of these cases may be community spread, meaning from person to person. Before that, they were thinking all of them were travelers. And before you blame all the tourists and all the haoles, it wasn't just the tourists and the international people. It was a lot of Hawaiians going to Vegas and coming back and bringing that junk with them, okay? So the majority of cases have been travelers bringing them into Hawaii. So anyone who says that the travel ban thing should not happen or whatever, they're not, you know, it should happen. In Hawaii is a very specific case, and I think it makes a lot of sense. Unlike other states, we can isolate off. Look at the globe. Look at where Hawaii is. Literally look at a globe. Don't look at Google Maps. Hawaii is the most isolated piece of land in the entire globe. That's a fact. It's more than the North Pole, more than the South Pole. Longer than a 3-hour flight to get here. You can get to the North Pole and the South Pole from another airport in less than 3 hours. So here's the thing. So, you know, we do have community spread now in Hawaii. We're going to have more tests. As I've said even yesterday, I think we're in the low hundreds. We're already easily up near 50 almost, and I think we're in the low hundreds. The only reason I don't think we're near 1,000 plus is you would have expected 1 to 2 deaths at that point that are suspicious based on, you know, statistics alone, a 1 to 2% mortality rate. Maybe there was a death and it's still waiting in a lab, and we'll confirm that we had our first death from COVID-19 coming. I don't know everyone, you know? So Julie Ann mentions, I'm concerned because see, she says, I have my concerns with cars and I live with my mother who has diabetes. Because of the shutdown, my work is considered important, so I have to be really careful. Yes. So again, that's along a lot of people. A lot of people. Oh, wait, what's going on here? Okay, I'm having trouble. Okay, it looks like I'm on a little bit of delay right now, so I'll keep talking. Okay. So, you know, basically, you know, yeah, it is very important because of the shutdown. Work is considered important. Some of us have to go to work. We do have to go to work. So that's very, very difficult. You know, we don't have the luxury of not working just for the paycheck. Oh, by the way, 7 of my, 5 to 7 of my friends, I got to count, were fired yesterday. Summarily fired from their jobs in Hawaii, okay? So people are losing their livelihoods here. They're not going to have their next checks. They may be on unemployment right away. So it's really crappy. Yeah, maybe we'll get these checks from the government, not me per se, because again, but maybe we will get those checks, and maybe people will be able to get their jobs back quickly, but we cannot know for sure. So Gennady said maybe the death rates are a magnitude lower. Yeah, Gennady is right. So again, what is mortality rate? Mortality rate is the incidence of cases of death from COVID-19 over what? The denominator is total number of cases, right? So if we have not tested a lot of people, again, the denominator, total number of cases, gets way larger and the actual mortality rate goes down. But it's too early to know right now, you know? Yeah, Stefan says about 6,000 jobs will be lost in Hawaii. I no doubt, I believe that 100%. They're saying, again, 20% unemployment. And again, which are the industries that will be hit harder? I don't want this to become an economics show, but again, airlines, tourism, hospitality, hotels, restaurants, service industry, unless the restaurants are set up for like more takeout, like Papa John's and Pizza Hut and those things. And then after that, we all know the smaller businesses. It's really, really, really tough. So that's the update again for the US. Now the update internationally, I'm getting kind of long in the tooth here, so I want to try to wrap this up. The update internationally is, I haven't focused on it as much, but again, Italy is still hurting very, very bad. Italy, you know, I read a statistic, something like 10 of the, or no, I'm sorry, 150 of the 600 healthcare workers in Italy are sick right now. It's basically something like a quarter of the healthcare workers, and I don't know where that means, like doctors, nurses, whatever, but people who are direct patient contact are sick. They may not be dying, but they're sick. So and maybe Italy was less careful, maybe they don't have the right equipment, I don't know. But if you're working in a field where a quarter of us are being sick and gonna need to be replaced, you're down to 3/4. After a little while, then you're down to, more. Like that scares me, not because we'll get sick. And again, I may be sick, I may not. I will update you guys, I promise you, on what happens. And I will get those results probably in 48 to 72 hours. That's really it, the healthcare workers are getting affected disproportionately right now. The N95 masks we don't have. I still, again, recommend, as you hear from your local community hospital, the smallest one, the better, honestly. The smaller the hospital, the better. They probably have fewer resources, and they're bottom of the pecking order in the totem pole. They may need some of those N95 masks. So if you have those for them, then they'd be happy to get them for you, and donate a couple if you have them. I actually bought my own personal equipment, like I said yesterday, to help me protect me. And I do want to go back to work. Believe it or not, I still need money like the rest of you guys. I'm still gonna get my paycheck. So I do want to go back to work next week, and I hope I can, and I hope I can help out. And I think I'm ready for that. I feel like my medical training has set me up for this. We used to work really crappy shifts during residency training, 30-hour shifts in a row, on call in the ICU every 3 days. It was brutal. Working with a lot of patients, it was very, very tough. For 20 years, I've questioned the need for this kind of brutality and that kind of like almost hazing, medical hazing, which I'm sure you've heard about from some of your doctor friends and nurse friends even. They go through a lot of stuff. I think ideally we will give them that answer about why it was important to have some of that, because we may need to do some of this stuff now. I hope we still avoid Italy. I still hope we can. But the more I go and see people not caring about the world they live in and not social isolating, I don't know anymore. I don't know anymore. So I'm going to end it with that. Please, guys, let me know the other questions. I will leave this open for 2 more. It's a lot to answer these questions by voice text. So if I answer right away, I'll try to answer personal text. If I don't right away, I'm just busy, and believe it or not, I do need to rest a little bit too before my shifts. So what I'm going to ask you is just be patient with me. Please talk to your other doctor friends and be supportive of the doctors, nurses, healthcare professionals that are going to be doing this stuff. Because trust me, if we would potentially avoid this too. I know doctors that don't want to come out of retirement to do this. I know that for sure. So it's not fun. Think about going into the hot zone when people are not wanting that. So understand that I might need some space at some point. If I don't get back to you right away, it's only because I'm busy working starting from Tuesday for a couple of days, and I will update you. I may take tomorrow or Sunday off from these podcasts, but I promise you, as soon as I get my result, or if I start feeling worse or whatever, I will update you day to day. And hopefully I can put a face on this, to the COVID-19 thing, both as a healthcare worker and as someone who is actually worried that I might have COVID-19 for legitimate reasons. Again, I'm very happy and thankful for all your support. Brian Coe asked, how does the paddling in residency help you during the pandemic? I did not go to the BDSM medical school of New Jersey or whatever it is. So I don't know about the paddling part, but there was a decent amount of hazing. I've been hazed pretty hard. I can talk about that in another post if people want to hear like the Scrubs version of that. So, Stacy, okay, thank you for putting this. So Stacy from Hawaii asks, maybe we already discussed this, but how safe is food delivery, food, and food packaging? That's tough. People are worried about cardboard in Amazon and all the they're like, oh my God, Amazon workers, are sick, and does it live on cardboard? I think the official thing is that like stuff lives on cardboard for like a day, and stuff lives on plastic for a couple of, I think. So my point is this: if you get food delivery, if you have anyone deliver for you, that's an extra step of contact. And that is, I'm not saying they're going to be sick and give it to you, but it'll probably be safer if you yourself go pick it up and you can tell that the only other person that touched it is the person who prepared the food and then the person who packaged it and gave it to you. But anytime someone prepares food for you, whether it's in a pizza box, whether it's in a plastic bag, I mean, if they cut up the food, right, they probably cut up some part of the food, there's a risk. So I'm not saying you got to make all your food and just eat out like Spam out of a can and do stuff. I'm just saying I cannot guarantee that all that food is completely safe. Could you get sick from it? Yes, you could get sick from it. From food packaging, let's say it's a box of macaroni that's sitting on the counter at a shopping center. I would worry a little less about that. But think about it. What have people been doing? They've been doing what you're doing. They're going up and down the aisle, right? They're touching the different boxes, and they're not cleaning their hands when they do it. They're touching the fruits. They're touching whatever. I mean, this is the problem, You don't have your own personal grocery store. Everyone's touching everything. I'm not trying to make people paranoid, and I hope people aren't too OCD or hypochondriac about it, but it's just legitimately what it is. Just keep that in mind. So anyway, and messaging, what PPE did you find? People said you can put single-use N95s mask and steroid on low. Not sure if okay. So what David is talking about is the N95 mask. Again, that blue mask is tight-fitted, and PPE means, again, personal protective equipment. PPE. I found my PPE. I found was this big, like industrial-sized mask that's washable with these pink circle P100 filters that I'll be able to leave in the room in a paper bag for each patient I see. And then I will only use it for those patients, and I'll buy different ones for each patient. I'll have another box that'll just be the N95s. I want to be a little less complicated, and my personal thing is I'll keep a paper bag in the room with the patient with my name on it that has my mask, and I'll reuse that one, even if I have to buy them myself. I don't know what the steroid on low is. I think it may be a UV sort of, I think some doctors on the East Coast are getting CPAP cleaners that are UV light and cleaning the N95s and their PPE in that. And that should work, I guess, is what I heard, is that the UV light will get rid of the PPE or of this on your N95 mask and everything else, but I'm not sure. Again, the CDC is saying, it's fine. You can wear bandanas like you're robbing a train, or like, covering your face from dirt. Obviously, nurses and doctors and healthcare workers hate hearing that we got to sew our own equipment. Like, where are we? Some third world country, or is this freaking hashtag America, right? Like, I mean, I may be a little arrogant, but this shows the failings of a healthcare system and the problems that we can't distribute stuff right away. There's another question. I want to address another rumor. You're going to hear a lot of rumors from all your moms groups, all your healthcare quasi friends that aren't in healthcare, that are very smart but aren't in healthcare and don't know how to read a study. I've had lawyers send me articles that they're very bright, who have asked about different things. And I had to point out that this research doesn't look very good. It's just dressed up like it's supposed to be good for homeopathic medicine. It's not to say I don't believe in homeopathic medicine. Some I do, some I don't. But to cure COVID, guys, that's too early to tell you that right now. Anyone who does that is trying to sell you a Brooklyn Bridge and, again, some tickets to the Fire Festival. The other thing I heard from a friend of mine is her mom groups are telling them that sunlight and temperature, this is another question, sunlight and temperature kill the COVID-19 thing. So it's good to bring your kids out to the farmer's market in the sun, because it will kill the COVID-19 on your skin and whatever. I don't even know what to say to that either. I mean, logically, you just say that and it sounds ridiculous, right? I mean, think about it. Even if the heat can kill it, it is not going to shake and bake you on the skin, and it will do it by leaving your place, as someone mentioned before, and taking your kids to a public environment around a bunch of crowds where you can't socially, distance yourself well. You are putting them more at risk. The risk reward benefit is more towards the risk. The reward that you could get baked and the coronavirus will magically evaporate from your skin is overwhelmingly, put down by the risk that you put them in and yourself by putting them back in public and touching all the door handles and car handles and fruit in the freaking farmer's market that everyone's been licking and avocadoing and and doing since that time. So please, if something sounds too good to be true, it probably is. Go to the CDC website. And again, I will read out the CDC website is where they talk about why certain people get the test and why certain people don't. It's cdc.gov/coronavirus/2019 dash lowercase n, capital C, lowercase o, capital V/HCP/clinical-criteria.html. Okay, that's very long. I will post it in the description below. The link that tells you why certain people get the criteria for getting lab tested. Again, the nasopharyngeal swab and not. There are, again, 3 types of people now. Hospitalized patients who have signs and symptoms compatible with COVID-19, meaning you have to be already in the hospital and oh my God, suddenly you have bilateral pneumonia. I wonder why you do. Because again, healthcare workers need to know, do you have it or do you just have regular pneumonia or something or the flu? So that's the number 1 person. And remember, that's not in the community. Number 2 are older symptomatic individuals that have chronic conditions or are in immune compromised state, diabetes, heart disease, receiving immunosuppressive medication. So if you're rheumatoid arthritis or lupus or cancer getting chemo, chronic lung disease, if you have really bad lungs on oxygen, or chronic disease. So those are the people in the community that are at higher risk and if they have symptoms should be tested. The number 3 is, and this is where I fit in a little bit, any persons, including healthcare personnel, who within 14 days of symptom onset had close contact with a suspected or laboratory confirmed COVID-19 case. Suspected. Last Friday, I was still in contact with a suspected COVID-19 case. It turns out she didn't have that. Again, as I mentioned, she had normal coronavirus. You can get sick from the normal coronavirus, but I fit into this criteria. So again, I do believe there'll be better tests later. And Stacy asked, okay, there's answer questions because I'm running really late. This is like an hour podcast. I didn't want to go this long. Stacy says she's taking some Clorox wipes to wipe down the gas handles. That's a good idea. Anything you touch that other people touch. Drawers, the refrigerator door when you go to Walmart, right? Those things or the grocery market to get food. And Linus says, if I want to help my older neighbors run errands, would that meaningfully reduce their risks? Linus, you're a gentleman and a scholar. That would be great if you could do it. Don't put yourself necessarily at risk, and don't just realize that that'd be great for them if you can get them some small supplies. The best thing I would do is coordinate with them on the phone and leave it in a clean container, ideally, outside their door, and then call them and let them know it's there. And they ideally can take it out of that container and not bring that container into their apartment. Again, that just makes sense because as clean as you can be, whatever container, bag, whatever, they have, maybe ideally it's a plastic or a paper bag or something, that or something that they don't need to bring that bag into their apartment. That would be the best thing. And Stacy, yes, I did already talk about the blood type thing the other day. It's hilarious and it's interesting, but it doesn't really help. Basically, people with blood type A in China, some studies were seen to have more rates of COVID-19 infection than blood type O. By the way, fun fact, I'm blood type O positive. So if I got COVID-19, that's the point. It doesn't really matter. It doesn't mean that if you got blood type O, you can't get it, and it doesn't really help anyone. We can't change our blood type. And if you're blood type O, will you be less careful? No, I'll still be careful. If you're blood type A, do you have to be even more careful? No, like everyone's got to be careful. Everyone's got to be careful. That's it. So it's like trivia. Maybe it'll even be true one day, but I cannot say it's true right now. I don't think any or researcher worth their salt will say it's true. It's fun. It's like, again, and I think why it's funny for Asians, a lot of people don't understand, but Koreans really care about the blood type. Type A and blood type B don't mix well and shouldn't date well. It's sort of like a funny kind of like what is it called? Astrology sign thing. O's don't match well with this and that. Like that's why Asians care about this blood type thing in health. That's why it makes me a little suspect about whether there's a real difference with this, right? So, and that brings me up to a point. Just talking about blood. They've said if there's one thing you can do, and yeah, is it slightly risky? Yes, because you're going to be interacting with people. Because no one's going out anymore, the blood stores, the blood donation drives have all stopped. If you want to do something, and it's risky because it involves a needle and going to a healthcare professional, someone that will help you get that blood, you can donate blood at some point. Now, we're not low yet, we may be, and I'm not asking you to go donate blood. I'd rather you donate N95 masks and do whatever. And again, generally, ideally, we don't need a lot of blood because we're not doing all elective surgeries, all elective stuff is done right now, Ideally, but sometimes maybe someone's having stomach bleed and they come in an emergency room, they will need that blood. So blood stores are low. If you're whatever blood type you are and you feel really like you want to help, you could do that. I don't want to say you should do that because obviously as soon as you leave that door and go to a healthcare area, you're slightly at risk. You can cover yourself with the mask and everyone hand sanitize you, whatever, but it is risky. But we are started running out on blood. But let's take care of the equipment first. And maybe the blood later. I will keep my ears to the ground. I am in multiple physician groups, both on the state of Hawaii and nationally and internationally. So I think I'm getting more of the accurate news and studies than most of the people on my Facebook group. Again, any last questions? I think I answered most of everything. I've repeated a ton, and I'm sorry about that. And this is a little disjointed. I will try to be back here on Sunday. I definitely will be back before Monday, and I start work on Tuesday, and I hope I can go there. I hope next time I see you guys, I have good news for you, and I'm COVID-19 negative. Okay, last question. Stacy, I got to make this the last question because I got to go. I just need a rest. So Stacy asked, so they're using the antibodies from recovered patients now? Okay. So this is another big question about the test. People are like, why can't you just see whether you're antibody positive for COVID-19? And that test would be a lot easier. Like we see whether we've gotten antibodies for hepatitis or whatever. They haven't really, I think part of it is they haven't done the research to see that these are legitimate or easy, and the labs aren't set up to do that test yet. So I would love to tell everyone, hey, you know what? We can't do the PCR long-term swab, but we can all go to your doctor right now and get the blood test, and we can tell whether you have antibodies or not. But I don't think we can do that. I believe they are drawing blood from survivors in China and other places to see whether we can make a vaccine from their plasma and stuff. I think they're doing that. Obviously, it's way far away, and the whole timeline on researching vaccines takes a while. It's not like these movies like Contagion and some. I think I was watching The Flu. Thank you, Brian Coe, for introducing me to that movie. It was really scary, but it's not like, oh, you rescue the ones and then you get a bunch of the blood out and you throw it into like a replicator and suddenly you're pumping out gallons and gallons of vaccine. That crap only works in Hollywood. It's not how it works. Like the antibody test will be very useful later. Yes, it will. And maybe we'll need to revise it for COVID-20 and these other things. But Casey says, I think they did something like that with both. Yeah, probably. But right now, I haven't heard about a good antibody test. Okay. So that's it. And I'll leave it at that because I'm going on an hour long. And this is really, guys, stay safe. Hug or no hug, elbow bump or air bump your loved ones. talk to your family on FaceTime. I FaceTimed a good friend of mine, two of them in the last 2 days, and it's hard. Try not to talk about COVID-19, talk about anything else. Keep your mental health, what it is, whether it's video games, whether it's, stress eating a little bit, doing whatever, self-care is what it is. You got to take care of yourself. A marathon, it is not a sprint. We're going to be in this for a while, all of us. Okay. So, I care about you guys. I've told everybody, I am going to self-isolate myself and social until I take care of my last COVID patient. So most of you won't see me in person, even in Hawaii, until maybe 1 or 2 weeks after I take care of my last COVID-19 patient. This could be months. This could be months I won't get on. This could be months I won't see some of you guys. But I will check in on you this time, okay? Lisa asked, when is my next podcast? Lisa, as I mentioned, I need a little bit of a vacation from this. This has become a lot more successful than I thought it would be, but it's draining to do it every day. So I'm going to take off. Probably won't do it tomorrow. Once I get the test back tomorrow, then I'll do it. I'll probably do it on Sunday, and I'll definitely do it by Monday if I don't do it Sunday, okay? So that's it. And again, please share this. If you'd rather your friends hear information, and I'm not the expert, but I am a healthcare professional who I think knows more than most, just share this link or my last podcast to them. You can have them add me on Instagram at thetraveling_MD. I'm on Twitter at thetravelingdr. I haven't used that much. And again, I'm on YouTube. Just search for The Traveling Doctor. I haven't posted anything up yet. It's mostly Facebook right now. But I may start getting more into Instagram and YouTube, and depending, because this is getting a little more popular than I thought it would be. And I know everyone's scared, but keep the faith. We don't have a lot of good leaders on some levels. We need some inspiration, and let's just all do our part. Stay safe, stay clean, and I'll see you guys on Sunday maybe, okay? Aloha.